You are likely to talk to your pharmacist and see them more than a medical provider. They are actually the most trusted profession.
What we've lost over time was, remember, your doctor was your local neighbor, and so was your pharmacist. And now it's all corporatized.
You know, when I first started as a pharmacist, someone come in and they didn't have the money. It was just, they trusted you to be like, you know, just add a few dollars and just help them out. But it's not like that anymore, so.
One thing that people struggle with is the cost of healthcare, not only for us as consumers of healthcare, but also providers of healthcare, in particular our community health systems.
It's a struggle with the way the system is set up here in the United States. Boots on the ground, primary care, and local community pharmacies, it is hard to break even.
There's a lot of space between the manufacturer who makes the pill and then the end user who uses it. So a pill X that costs $10 to make, by the time it makes it to the end user, may be $300.
We've seen people try to cut their prescriptions in half or take it every other day. Or it's some of the high dollar medicines people really can't afford these days.
We're talking about life or death. And these are decisions in America you shouldn't have to make.
El medicamento para la diabetes es caro.
We want to be healthy. Why do we have to choose? Do we want to be healthy or do we want to live?
To a large extent, the financials of pharmacy are hidden from the staff. AWP, average wholesale price, and this one it says it's $567. I paid $38.95 for it. There's maybe 20 pharmacies in the country that operate the way we do. The role of independent community pharmacies in the healthcare system in smaller towns, it's a big part of why we've had such success here.
Being a small community hospital allowed us to sort of get buy-in. We couldn't do this by ourselves. We could not have one of these neighborhood clinics by ourselves without the help of the community.
It started first with Dr. Merritt and I taking a leather bag, right? Just going to talk to people. This is why we go into medicine. This is why we do what we do.
We're just like a normal pharmacy, but just a little extra.
This is a job that I've wanted. You know, this is what pharmacy should be.
Production funding for Life in the Heartland was provided by the Chrisman Family Foundation and by
All right, good luck. That's the fourth prescription that's over $500 so far this morning. Public thinks because they walk in and they pay a $600 copay for a brand drug, the pharmacy must be making out like bandits. Almost all of the cases nowadays, the pharmacy is likely losing money on that transaction.
We are actually paying more for medications than we're getting reimbursed. So we are losing money on prescriptions now.
That is a medication used to keep prostate cancer at bay. Standard retail price for this drug at the most common chain pharmacy in the country, it was $20,000. So you walk in, you've gone to your doctors, tell them your name, they bring your bag over, and they say, okay, it's going to be $996 so that you don't have a reoccurrence of your cancer this month. This cost me $75. This bottle, right? That doesn't seem fair, does it? Yeah, so where does that money go? The fault lies almost entirely with insurance companies and chain pharmacies.
What we have is a real problem with the pricing of these drugs in the marketplace. There are pharmacy benefit managers, PBMs, that actually dictate costs. They're acting as the middleman between the manufacturer, the creator, and the end user. And that's driving up prices for prescription drugs enormously.
Almost all insurance company contracts are one-sided. Pharmacies don't get to say, your payment's not good enough, we're not taking that.
There are only 4 independent pharmacies in our 2,500 square mile service area. 4. I'm the CEO of Tri-Area Community Health. We're a community health center in Southwest Virginia.
This is me getting my hair fixed. She was from the city, so she made us a country pharmacy. I was born and raised here in Laurel Fork. I grew up here all my life, and I feel like I was born to help people. Here's Kirby, and you pour pills into Kirby.
Community health centers are funded by the federal government. There's about 1,400 of them 1,500 across the country to provide care to those who otherwise can't receive it.
Our CEO, he had already mentioned this place as somewhere he had saw that really needed access to pharmacy and healthcare. It's just a very rural town, and like I said, it's there's only like 444 people in this town. He just felt like it was a really good place that needed a community health center.
People don't know how to pronounce the word freeze. It looks like fries, so we say freeze in the winter and fry in the summer. When I first came, it was very difficult to get a physician. There used to be a facility just to see the doctor, and sometimes she was in and sometimes not.
I guess we're ready.
I guess. It seems like just yesterday that we came together to welcome the Tri-Area Community Health Clinic to our town. Today we stand here to celebrate the opening of their new pharmacy, a much-needed addition to our community.
What I often say is, we don't want people to have to choose between medications and milk. She brought the big scissors. Hey, Sheila, can you do a 3, 2, 1?
3, 2, 1, cut. Hey!
Thank you so much. Appreciate your support.
Pharmacy, I love pharmacy. I love helping people. I love feeling like I make a difference. And in the beginning, it was like, we were the most trusted profession. We were the go-to. But I do think with the push for just revenue generating big pharma, those types of things has really changed the profession. If the pharmacists were allowed to be like it was 20 years ago, people would have a lot better health outcomes, I think.
Do you know if she called our location or if she called the Laurel Fork location?
The work that Tri-Area does in this area is very important. It's nice to see, that they opened up here in Freeze, and now to add the pharmacy services, that's real important to the community. So we think the pharmacy here will make a big difference.
Glad I got to finally meet you, put a name to face.
You're not just patient 36. You are Zach, who lives down the street, and our children go to school together. How are we going to continue to help people? How am I going to continue to keep people employed? The pharmaceutical companies want to charge as much as they can. The insurance companies want to pay as little as they can. And so we have to figure out how we can still take care of you.
It's tough, and I know for my staff, they have questions for me a lot because they're like, okay, we submitted this medication to the insurance and they're paying us less than what we paid. What do? We can't really turn people away. We can't say, sorry, we lost money on that. But a lot of the community pharmacies are having to do that.
This is the second largest county in Virginia. Not counting us, there's 2 left in the county. There used to be 4 independents just in Stanton. But people would drop off just the most random stuff. These are neat, just these little ones, but independent just means that it's not owned by a conglomerate. I don't have to call a corporate and ask permission to give Mrs. Smith a discount on a prescription. You're not expected to be an expert at it. That's one of the jobs. All right, we'll talk to you soon. Yes, ma'am. The nickname for pharmacy, at least in North America, was the most accessible healthcare professional. You don't usually make appointments to come into the pharmacy.
Trilogy is good morning, y'all. So Trilogy comes in two primary strengths, 100 microgram and 200 microgram.
We treat pharmacy like you would treat any other retail business.
Wholesale cost on what we would pay for one of those inhalers is $638.
Wholesalers aren't the bad guys, in my opinion. There is negotiating room with them. Certainly big pharmaceutical manufacturers make billions of dollars a year, and they're the driving force behind the high cost for brand drugs. But brand drugs only make up a small percent of what's dispensed in the U.S.
I'm sorry, Honest Drugs. This is Laura.
Within the last 3 or 4 years, the percent of brand to generic drugs has changed dramatically. So we thought, well, let's try for that 90+%, see if we can make a go at it.
It's not pharmacy if you're not multitasking.
We don't accept insurance. The insurance company contracts have forced the pharmacies to jack the prices up because in that contract it says that we can't charge anyone else any less than what we would bill the insurance company. That is why the cost of prescriptions in the United States stay high, even though we have never had a larger number of medications available as a generic.
Like nursing coordinator.
It's been a dream of mine, ours, to have a pharmacy for a couple of decades. Every day we have customers come in, can't get in to see their doctor. They don't know if they should. Wouldn't believe the things that people have brought in and had us take a look at.
Have a good weekend. Y'all take it easy now.
There's a special place for a community pharmacy in a small town. We have given some space to local creatives and business owners. We wouldn't be able to have done this model pharmacy without community support. We're doing this in a way that is not supported by the industry. You know, the industry is built around billing insurance, and basically blind transactions.
There is one drug out there that can do the same thing that has a generic. The drug's called Pradaxa. Shouldn't have even left the office with that script. Provider.
All right, give me just 1 second to get you the pharmacist so that he can do the official approval on that, okay?
I don't talk about it a whole lot, except for in my family. I suffer from chronic pain. It's messed up back. I think it's put a lot of perspective on the innate suffering that is just life, right?
Watching my father fight cancer for 14 years was really a life-changing moment for me. One, it proved that life is fragile. But two, what it really proved is life is worth fighting for. And that's the fight I want to be in. Down here in Southside Virginia, people pay 36% more for their prescription drugs than they do in Stanton. I understand the free market. I'm all for the free market. But a person who needs that drug is a captive audience. Some of us on both the Democrat and Republican side who live and represent people in these rural areas really saw that we had a problem. And so what we were creating was a pharmacy board made up of individuals and citizens of the Commonwealth of Virginia who don't have any bias or conflict of interest, non-legislators, who would look at drug pricing and see where we could do better to make it more affordable or more accessible so that people in our areas, in our rural areas, were not overpaying for medication that they needed. We have this opportunity, this honor and this obligation as legislators to actually put something together that's going to change somebody's life.
Senate Bill 274, Prescription Drug Affordability Board established Drug Cost Affordability Review Report.
2/3 of all Virginians are supposed to take prescription drugs, and similar, 2 of every 3 Virginians worry they won't be able to afford their medicine this year.
We are going to be spending money to set this up, and we are not going to see the benefits. We all want lower prescription prices.
One of the reasons why these boards have not been as successful in other states is because they've been stripped of a lot of their power by some of the interests that want to keep prescription drug costs higher.
The question is, shall the bill pass in the enrolled form, notwithstanding the objections of the governor? Those in favor of that motion will record their votes aye. Those opposed, no.
It seemed like a very common sense solution. and a good start. Not the finish, but a good start. But yet got vetoed by our governor.
We can't educate Congress enough or the General Assembly enough to offset what the pharmaceutical companies or the insurance companies can do. In the United States, we're a capitalistic society, and so their incentive is to make as much as they can, which, again, in a capitalistic society makes sense. But from a human perspective, you get lost in that.
Yo encontré a una doctora aquí que me dijo que mi salud estaba muy mal. Realmente yo no lo sabía, nunca lo supe. La verdad es que casi muero. Yo creo que traer salud a la comunidad es una de las cosas más importantes.
If we don't provide this service, people are going to get really sick. Bad things will happen, and we can act on it now.
We realized through COVID that there were large segments of our population who did not have access to care.
It's really far from a pharmacy and really far from healthcare providers. Taking healthcare to people in a location that it was easier for them to get to made a lot more sense.
What you're going to do is you're going to hold on to these and just show them to the nurse. So a lot of people have said that, you know, I don't know what I would do if you all weren't here at this particular location. Vente trays.
As our healthcare system has changed, people don't get to see the same provider each time. A lot of times they'll see a provider one time and then that person will be busy. They'll have to see somebody else in the clinic. And it's really nice to be able to see the same provider over and over again because that does build relationship and builds trust.
See y'all. See ya. Thanks for coming too.
Of course.
I really like living here. It's laid back and I wouldn't live in a city unless I had to, of course. My ex-husband lives on Hanky Mountain, and I go to his house all the time, take him hot pepper cheese and different stuff.
Oh, that's nice.
Make him apple pies.
Oh, wow.
Well, so cold out. That relational aspect of medicine is so imperative.
Get my blood pressure down.
Oh, we're gonna work on that, right? This is an A1C machine. It's a little temperamental with the temperature. Just in our clinic alone, ER visits are down almost 20%, urgent care visits are down 40%, and hospitalizations are down 60%. Daryl has a head. Was at one time the largest buck queue in the state of Virginia. He's a huge. Huge.
Wheeler over there.
Yeah, Kim.
Hi, Kim.
Hi there. How are you, sir?
I'm ready, Kim.
You're ready.
Well, we've had 45 people register so far today, which is quite a lot considering we've only been open for just over an hour. Sí.
He estado aquí por 10 años. Hace 2 años tuve un accidente automovilístico y me fracturé la médula espinal. Y ha sido un giro muy grande en mi vida. Antes era independiente como cualquiera de los demás y ahora.
Augusta Health is one of 5 remaining community-owned health systems in the Commonwealth of Virginia. The focus is community health and well-being and not maximizing profits. Community hospitals were very common in the United States. Many of them could no longer sustain their mission because of finances, because of losing their populations, the rural populations. I grew up in Monrovia, Liberia, and that is in West Africa. My great-grandmother was a practitioner of traditional medicine, looking to nature to take care of those things that nature can take care of, and respecting pharmacology when it is necessary. We're trying to move away from focusing on providing care to the sick to keeping people healthy.
Yeah, so this is the old Yoder farmstead. It used to be a dairy operation.
We have 1 1/4 acres farm here on campus, what we call our food pharmacy program.
access to healthy foods and, proper nutrition are key in preventing these chronic diseases such as diabetes that's so widespread in our area.
The American diet is severely lacking in fiber, so we focus on growing a lot of that so that we can meet that nutritional need. It's one of those things, nobody comes to the hospital for fun. I think everyone knows that. Yeah. So by being able to offer a place that has respite and a purpose that it is preventative in the long run, but it is connecting so much more than just a physical ailment.
It is a great stress reliever too to come and get your hands in the dirt and just kind of unplug.
The system is in place. There are health centers covering all of Virginia. We're not unique, we're not special. We're part of a bigger system. It's just a matter of making it work for us. We need to fix the bigger healthcare system.
You're essentially providing a profit for the company to give a fair amount of the product away.
I'm still by myself today. I have to scan these. I started driving medicine in 2000. My mom had a med for her lupus that was outrageous. I mean, it was like $400 just for one pill. It's like you have to choose now whether you want your meds or you want your mortgage. I am from North Carolina. I'm so country, and my mom is Vietnamese. So I'm Asian country. I don't even think. He's still sick. He's on the phone right now.
Hey there, you taking care of yourself?
Hey, Miss Donna.
You having chicken soup?
Yes, ma'am. There's so much that comes from just making them little 6 stops, bro. And we deal with this medicine every day, and it's so much more to a job. We don't even know all the people that we helping by getting the medicine there early.
For me, it was just job and money and numbers at first. And then as I started going, I realized that people need this. Here I am, 1:30 in the morning, driving an hour and a half away with diabetic socks. And when you get there and you see the relief on the patient's face, you're like, wow, okay, yeah, I think I did make a difference. I wish they would get a hold of it so that everybody could feel like they are going to be taken care of regardless of their health situation. As I would be scared to get sick, in a nation like this.
You can't plan an illness. It's always unplanned. And when you're in that situation where you're living paycheck to begin with, and something happens, and now you've got to make life or death choices.
I think the whole town was without power. I'm not sure how many days it took them to get power.
Can you get in the lower floor? No, I can't in there.
With the hurricane, everybody didn't get out.
Yeah, we had them all scheduled that week, didn't we?
And so you're saying the water came? Yeah, it came all the way up to pick up these lines.
Everything off of my river lot, we lost all that. Trees fell on the camper was flooded. That was everything I had. So, but the 2 neighbors on both sides, their campers went over the dam. So they lost both campers and everything inside.
How can we help each other either get through something as a community that's a challenge, let's say with the weather incidents that are happening now, or a fire or something along those lines, or you're struggling with a health condition, or you lost somebody and so now you need some support.
How do we fix it? How do we still make sure we're staying afloat? If it was every script that we lost money on, then, we wouldn't be able to be here.
It keeps me up at night to think about, what could happen if we can't continue to provide the medication and the health care to people. I'm gonna get emotional. It's hard to think about. It's just the right thing to do.
La verdad es que hay mucha gente allá tratando de ayudar y gente muy buena y muy linda, pero también las necesidades son impresionantes.
Mi fuerza para salir adelante es mi familia. bien, con la gracia de Dios, saliendo adelante.
There are many people who are very interested in taking care of their neighbors, and that's the good work that I hope that we continue to do, working together.
We don't have to rip people off to make a profit.
We'll get ready for about now. Thank you. The doctor's office will see 12 to 20 patients a day. You know, pharmacy is going to see 200.
Independent pharmacy is still the lifeblood of pharmacy in many areas. We're in places where chain pharmacy don't feel like there's enough profit, but we need to come back and be at the heart of healthcare in every community.
All right, we're gonna be $1 today.
There's very few to compare it to, but there's more coming. Many more coming, I hope.
Okay, I'm gonna let you talk to the pharmacist. Hold on just a minute.
Production funding for Life in the Heartland was provided by the Chrisman Family Foundation and by
Babbling brook reminds us flowing holy. Plow the earth and plant and weed. Watch your children grow. Day breaks into nightfall, soon we're reaping all we've sown.